Starting this week, infants, toddlers, and preschoolers will be able to get vaccinated for COVID-19.
Pharmacies in Milwaukee are already receiving doses. Our Christina Van Zelst breaks down what parents need to know.
It's a moment 2 years in the making. The CDC giving the green light for kids 6 months and up to get the COVID-19 shot.
The reason it took so long to get them for kids is because we were so careful about making absolutely sure that these vaccines were safe and that we had the right dose.
The pediatric shot comes in 3 doses for Pfizer, 2 for Moderna. So far, only mild symptoms have been reported, like a fever and a headache.
I think we were pleasantly surprised that for both of the vaccines, we were able to get away with a markedly lower dose to still get a decent immune response, but really save them a lot of those side effects.
The authorization expands vaccine eligibility to nearly 20 million kids. Infants younger than 6 months are now the only age group not eligible for the shot. But UW Health doctor Jim Conway says we're not in the clear yet.
I think the part that we're still wrestling with is the ongoing mutations and the new variants that keep emerging.
Conway says the timing of the shots could result in a more normal school year in the fall. But what if your kid already had COVID-19? Conway still says get the shot. It could boost your child's immunity.
You really can't count on the infections themselves being that protective. The wild type infection just doesn't seem to be nearly as protective as the vaccine itself.
After 2 years of waiting, doctors say there's still a ways to go when it comes to stopping the pandemic altogether. In Milwaukee, Christina Van Zelst, FOX 6 News.
UW Health says the shots should be available in Wisconsin this week. If you are hesitant about vaccinating your child or you still have questions about it, you are urged to talk to your pediatrician.